What are the symptoms of hypoglycemia? So, what you're going to experience is you first are going to, you could get really shaky. You could get irritable, like you're really short, like any type of little thing makes you angry. You get a little shaky. You get fatigued. You get brain foggy. These are the symptoms of hypoglycemia. You could even get a little faint. That's very common too. So, those are the symptoms of when you do know that your blood sugar is likely low. So, let's talk about like what are the effects of having hypoglycemia often. So, what happens when you have this all the time is there's this huge fluctuation of your hormones that is occurring when you have this spike of blood sugar and this drop of blood sugar. Okay. So, what happens is most people, what happens with the hypoglycemia is they get a lot of sugar going into the body. Your body makes a lot of insulin in response to that. And then that draws the sugar out. And then it actually goes a little bit too low because many of these people that suffer with hypoglycemia produce too much insulin in response to that. So then they get their sugar too low. First, your cortisol is produced in response. It's a stress response. Then your liver produces a lot of sugar and that elevates your sugar again. And then you have this insulin effect. And let's talk about like what is the problem with this insulin being stimulated all the time? And I talk to this a lot with my chronic ill patients is too much insulin in the body has been linked to so many different chronic illnesses. It's been related to autoimmune disease, it's been related to cancer. A lot of my anti-cancer protocols are related to decrease in insulin effect because it has insulin growth factor, which will stimulate growth of cancer. So it is a big deal to really get this taken care of and make sure that you don't have these big fluctuations of your blood sugar because it's really stressful on the body and it makes other conditions worse. I'm not going to say that hypoglycemia is going to absolutely be the cause of autoimmune disease, cancer, or whatever, but it's a piece to the puzzle to why someone gets it. Yeah, let's talk about the causes of hypoglycemia. So, obviously, someone that hasn't eaten for like 8 hours is going to start experiencing hypoglycemia symptoms because they just have no sugar in their bodies anymore. And their sugar keeps on going lower and lower and lower and gets to a point that your body starts experiencing the symptoms that we just talked about. So, that's normal. But let's say you are someone that is experiencing low blood sugar after 2 hours after eating and you experience that often, at least more than 2 times a week, that's tending to start becoming more of a chronic hypoglycemia issue. And what are the causes? So let's talk about that. So, big causes, okay, yeah, we talked about not eating yet. That's one. But the big one that I see often is people that eat a lot of carbohydrate, especially refined carbohydrate without any fat or protein in it. A lot of people are going to experience hypoglycemia. So, what happens is all that sugar gets into the body and then your pancreas sees it, boom, it produces a lot of insulin in response, and then boom, it takes all that sugar out of there. And it's not a slow trickle, there's a huge spike that happens. So if you have protein or fat in there, it slowly trickles the sugar into there. But if you're eating just pure carbohydrate and nothing else in there, it's going to cause this big spike, and then that's going to cause your blood sugar to decrease, and it's going to go through that whole cycle that we just talked about that happens when you eat too much sugar. So that's a cause. Another one is chronic stress. So even just acute stress will cause a spike of your blood sugar, and then your insulin is going to be produced and that drops it too. And then it causes that vicious cycle. If you're undergoing chronic stress, you always will just have high blood sugar. Your body will always be making tons of insulin in response to that. And then it just dysregulates your whole blood sugar rhythm. And that could be a huge cause of hypoglycemia for people. And another cause related to this is adrenal fatigue. People that are actually in a stage 2 adrenal fatigue, they're actually producing too much cortisol, not too little cortisol. That could be a big cause of hypoglycemia. That's a symptom that I'm looking for to make that diagnosis of adrenal fatigue. Another one, some people just start getting sensitive to when high amounts of sugar get into their body. So, not even without just pure carbs or refined carbs, they get carbs in there and their body just produces way too much insulin in response to that. This is usually the beginning stages of your cells starting to become desensitized to insulin. This is a common thing that we see. People start getting hypoglycemia more often, making way too much insulin in response. And that's the tall sign. Oh, maybe you're starting to get some insulin sensitivity, and we really need to start working on regulating your blood sugar. Other causes is like insuloma. That's a tumor that is producing way too much insulin in your body, and that's causing hypoglycemia. This usually doesn't matter when you eat or not. You just are always pretty much experiencing hypoglycemia symptoms. What can we do to decrease these hypoglycemic episodes that happen? So big one is you need to get more protein in your diet. I wouldn't really ever have a carb, and that includes like an apple without any type of protein. So a great combination would be like an apple and some peanut butter. So you want to really limit the pure carbs that coming into your body. You want some protein, you want fat to go in there because that's going to cause that slow trickle and it's not going to cause that spike of blood sugar, which will cause the hypoglycemia. You definitely, which I remember as a kid when I was in high school, there was someone that said they had hypoglycemia. And they were like, I just need to have a candy bar in my pocket all the time. I need to have a candy bar because I'm just going to faint and pass out if I don't eat my candy bar. And now thinking back of my understanding of hypoglycemia, that's like the worst thing you could do is eating sugar all the time. This is a huge vicious cycle. And that's what most people do. I talk to them as patients all the time. They say they have hypoglycemia. They're just eating a lot of sugar. That's the worst thing you could do. You definitely don't want to do that. You want to make sure that you actually have some nuts or some other protein, the beef stick or whatever is a much better option to keep your blood sugar under control. So dietarily, that's what you want to do. Some other things that you could do is you want to work on your stress because, like I talked about, stress is a big cause of high blood sugar, leading to possibly hypoglycemia because of the over response of the insulin in response to that. So, we want to do whatever we can to decrease stress. Spend some time doing things that you love and enjoy. Maybe you could take some things that will help support your stress, like maybe some ashwagandha or magnesium or whatever. Make sure you're getting plenty of sleep so that will help with your stress a lot, etcetera. So those are some things that you wanna do to help with the blood sugar dysregulation that's happening in your body. And if you do have adrenal fatigue and you've had that diagnosis, you wanna go to a doctor and get that taken care of. And people with adrenal fatigue usually are tired often. They wake up tired or they have a big drop of their energy in the afternoon. They might crave sweets a lot. They usually crave salt a lot too. These are some quick symptoms of that, so you wanna get that treated appropriately. Let's talk about some issues that might be you have to go to a doctor. So you are eating the high protein breakfast or you're eating a really healthy diet and you still continue to be getting these hypoglycemic symptoms, or like it's very common for you just to you eat a little bit of carby meal and you get blood sugar issues after 2 hours. And this is common for you all the time. So you need to really get things checked out. You need to check to see if you have an adrenal issue going on. You need to take a look if you have an insulinoma going on. You need to take a look if maybe you are starting to get diabetes. Maybe you're pre-diabetic or even maybe full-blown diabetic because you will have these hypoglycemic episodes that happen too when you're in the beginning stages. So you don't want to really just sit around and be like, oh, I'm just a hypoglycemic person because it definitely could lead to big problems and it can be preventable and maybe not lead to these long-term consequences that happen with the hypoglycemia, like diabetes is the most common one, or cardiovascular diseases or metabolic syndromes. It could be taken care of really effectively by a doctor that knows what they're talking about, and you can prevent these bad issues to happen in the future. Yeah, so if you're interested in treating hypoglycemia, visit my website, integrativemedica.com. Find my phone number there, call my receptionist, set up an appointment. You could also set up an appointment directly from my website. And obviously, we do virtual appointments, so no issue there. If you want to learn more about blood sugar management, click my videos to the right. I'm Dr. Jake, and I'll see you there.